Warfarin is an anticoagulant drug. The most common brand name is Coumadin. Warfarin is used to treat and prevent various conditions such as myocardial infarction, atrial fibrillation, pulmonary embolism, and venous thrombosis. Any patient that is at high risk for blood clots that are harmful can be put on warfarin. Pharmacokinetics. Warfarin is taken orally once a day, most often in the afternoon or evening. Warfarin dosing is different than most medications. The dosing is determined based on a blood test measurement called International Normalized Ratio, or INR, which is an assay for determining the time of coagulation. Patients on warfarin are advised to have regular INR blood tests, usually every 2 weeks. This ensures that the patient is experiencing therapeutic anticoagulant effects and that their blood is not becoming too thin. INR is the reason patients are advised to take their warfarin in the afternoon or evening. This allows the patient to change their dose based on the test results the same day as the provider advised it. A patient on warfarin could be on a dose as low as 1 milligram or as high as 10 milligrams daily. Warfarin is absorbed by the body in the liver. It typically reaches maximum plasma concentration within 2 to 6 hours after dosing. It is metabolized by cytochrome 2C9, cytochrome 1A2, and cytochrome 3A4 enzymes. Each of these are cytochrome P450 enzymes. There are 2 enantiomers of warfarin. Most often, people are prescribed a racemic mixture of both enantiomers. Based on the enantiomers prescribed, different enzymes break down different parts of the drug. Warfarin is primarily excreted as metabolites by glomerular filtration in the kidneys. The elimination half-life is about 35 hours. Pharmacodynamics. Warfarin works by interrupting the vitamin K coagulation cascade. It depletes vitamin K, which reduces the synthesis of active clotting factors. Warfarin interferes with this cascade by competitively inhibiting the vitamin K epoxide reductase complex 1. Side effects of warfarin include, but are not limited to, increased bruising, high frequency of nosebleeds, reduction of bone strength, and menorrhea, or extremely heavy menstrual periods. History of warfarin. Farmer Ed Carlson from Wisconsin kept having cows die due to an abnormal bleeding. He drove with a dead cow, a jug of unclotted blood, and some of the moldy cloverleaf hay that the cows were being fed to the University of Wisconsin-Madison to biochemist Carl Link so that he could figure out why his cows kept dying. Carl Link and his colleagues found a natural substance in the hay called coumarin, which was being oxidized as the hay would mold. Years later, after studying this compound, they found a derivative that could be used as a rodenticide. This compound became known as warfarin. By 1952, warfarin was approved for public use as a rodenticide. That same year, a 22-year-old Army inductee tried to commit suicide by ingesting the rat poison. He was rushed to the hospital after having an ongoing nosebleed and being doubled over in pain. Once in the hospital, doctors began treating him with vitamin K, which completely reversed his effects. This was when doctors realized that warfarin could be used by humans as a powerful anticoagulant drug. So the timeline of warfarin went like this. In the 1920s, cows began to die. In 1940, coumarin was discovered. In 1948, the synthesis of warfarin occurred. In 1952, warfarin was approved as a rodenticide. And in 1954, warfarin was approved for human use. Clinical trial data. Although warfarin was approved by the FDA in 1954, there are still ongoing trials all over the world to test different medications and conditions with the usage of warfarin. Some of these clinical trials test patient education and medication adherence to taking warfarin correctly. Some look at warfarin and how it works in patients who are undergoing cancer treatments. Some are trying to get more information about how warfarin works in healthy patients. Some are looking at how warfarin interacts with mental health pharmaceuticals. There are wide varieties of studies being done all over the world to get more information about this drug. The shortcomings of warfarin. Summary of the warfarin side effects. Increased and more severe bruising, nosebleeds, decreased bone density, and menorrhagia. Tolerance. Warfarin resistance can be caused by patient noncompliance. Most common patient noncompliance examples are not taking the correct dose, missing or doubling up on doses, and not participating in appropriate medical testing with the provider team. Tolerance can also be caused by patients consuming food high in vitamin K. Negative drug or food interactions. Patients on warfarin should not consume alcohol as it has anticoagulant qualities. They should also not consume foods high in vitamin K, such as leafy green vegetables. Green tea should also not be consumed as it contains concentrated vitamin C. Patients taking warfarin should not take NSAIDs as pain relief, as they also have anticoagulant qualities. There are ongoing studies about possible interactions with SSRIs, so individuals should talk to their doctor about the possibility of increased bleeding risks while being on SSRIs. Patients taking warfarin should also not take other anticoagulants or antiplatelets, as they can also increase the risk of bleeding. Populations that should not take warfarin. Pregnant women should not take warfarin, as studies show that it can cause birth defects in the baby. Women who are breastfeeding should also talk to their doctor about other anticoagulant options, as it is unknown what it might do to the baby being breastfed. Patients taking warfarin who are preparing for surgery should talk to their doctors about how to proceed. Most often, patients are asked to stop taking their dose 5 to 10 days in advance. This allows blood to clot normally and decreases the risk of hemorrhaging during surgery. The summary of warfarin. Warfarin is an anticoagulant drug.
Yo, dog, you better pay attention for sure, cause there's a lot of stuff about this drug you need to procure. Its name is Coumadin, it has many indications, its use is paramount in anticoagulation. Coumadin, rock to the beat, by the end of the jam, your knowledge will be complete. Okay. I take Coumadin so my blood be thin. I can't take products with aspirin or NSAIDs like ibuprofen. Instead, need to take acetaminophen. Take a therapeutic dose at any rate. An INR of 2 to 3 is usually great, but you better stay away from several spinach plates, otherwise you might tend to coagulate. Coumadin, this is my ode. I call my doctor when I saw black stools in the commode. Coumadin, protect against a clot, cause they like to happen when my blood is thick like snot.
Tablets of 1 milligram, 2, 2.5, 3, and 4. Lots of combinations cause they're individually scored. 5, 6, 7.5, and a 10. Slightly higher doses that will keep your blood within. For a DVT, it can be really fine, but remember it's metabolized by CYP2C9. That will affect drugs like phenytoin and macrolides. Adjust the dose so you might take a coffin for a ride.
Coumadin, you're highly protein bound. Too much free in my plasma could be harmfully profound. Coumadin, inhibit clot cascade, and I on my K factors and make sure they all behave.
You gotta take one pill.
You gotta pop one pill.
You gotta take one every day.
Being non-compliant
Could cause you to stroke. That could ruin your day.
Coumadin, you could be my friend, except for the fact you're an established teratogen, so you can't take this drug if you're pregnant with a baby, and once it's born, breastfeeding's still a maybe.
So call your doctor if your stools are tarry, bleeding gums, bloody noses, lots of bruises, that's alarming. Coumadin, you're prone to be hemorrhaging, but you're safer and more efficacious than heparin.
So I hope you've learned something from this song. If not taken correctly, things could go wrong. That's how you take this life-saving medication, so spread the word through this hip-hop education.
Created using Powtoon.